Working It Out, a podcast show about diversity, equity, and inclusion in our workplaces, our communities, and our lives. A show where we put diversity and inclusion to work.
Got problems on the job, we're working it out. Workplace got you stressing, we're working it out. Yeah, we're working it out, working it out, working it out.
Welcome. I'm Dr. Vanessa Weaver, your host of Working It Out. On this episode, we're going to discuss how to improve healthcare equity through helping underserved children. I'm joined by Dr. Andrea Boudreaux, who is a committed healthcare executive and pediatric psychologist. Andrea has had nearly 2 decades of progressive leadership in healthcare administration and clinical practice. She is a dedicated clinician who recognizes the plight of minorities in both mental and physical health. Interestingly, Dr. Boudreaux is a graduate of Howard University and Texas A&M University of Public Health. Dr. Boudreaux recently returned to Washington, D.C. to serve as the Executive Director of Children's School Services, a subsidiary of Children's National Hospital. She oversees nearly 200 school-based clinics, addresses the needs and improves health outcomes and access for over 90,000 children across the district. Today, we're going to discuss her work. Welcome, Dr. Andrea Boudreaux.
Thank you so much. I'm honored to be here with you.
Well, I'm so happy you're here. I mean, part of that is because I knew you when you were completing your PhD, and you went to New York and did some phenomenal work serving underserved populations in New York, and we were able to get you back to Washington, D.C. I was so surprised, though, that the Children's National Hospital provides this kind of service. Can you tell us a little bit about that?
Absolutely. We have been the recipient of the School Health Services Program through the Department of Health for a little over 20 years now. So we serve every public school in the Washington, D.C. area. Public schools and then the public charter schools are eligible for services through the Children's School Services Organization. We partner with Children's National Hospital, and we have other very generous benefactors who support our work, but we partner directly with Children's National Hospital to support that care continuum and ensure that the continuum of care, I tell people every day, just because the school bell rings, the child's health needs do not change. And so all of those things that are present with them when they're at home, that have them going to the doctor's office, all of those things present in the school building as well. Our job is to ensure that the children are healthy so that they can be educated.
Well, when you say they present in the school, what are some of the ways, what are they presenting? I mean, what are the signs that they're showing?
Oh my goodness. Right now there is such a high prevalence of asthma in the district. We are also seeing increased rates of type 1 diabetes. Unfortunately, type 2 diabetes in children is also on the rise, but certainly a lot of work being done around type 1 diabetes, which must be controlled by medication. Type 2, we do think that diet and exercise impact those illnesses, but type 1 requires insulin administration. And then the most unfortunate and the thing that I'm so passionate about is the behavioral health. The rates of depression and anxiety with our children is just on the rise. The Surgeon General recently said we're in a crisis, a mental health crisis for children in the country.
I know I would say that almost every other day on the news, they're talking about mental health issues in teenagers and children under 12.
Absolutely.
And children as young as 4 and 5 and 6 years old. So the work that you're doing is clearly very, very much needed. And I'm excited to have you talk to us about it. So let me ask you, Dr. Boudreaux, when they talk about healthcare equities, what does that really mean? Because that's a big word, healthcare equities.
Yeah, I tell people.
How do you define that?
the world has equity fatigue because we've talked about diversity, equity, and inclusion so much. And so thank you for asking that. Diversity is getting the right people to the table. That's the piece that's in the human resources department. That's making sure that you reflect the community you serve. Does your leadership, does your staff look like the people? When people come into your organization, do they see someone that looks like them? That's diversity. There's a lot of work being done. We have an amazing chief diversity officer and an amazing committed group of individuals who focus on that piece, getting the people there. Inclusion is making sure that when those people are in the room, when they're seated at the table, we're talking about everyone that's at the table. So it's one thing to have me sitting in the room and I have to be quiet in the corner. It's another thing for us to be hearing and listening to what I'm saying. But this equity piece, and this is the part that's the most challenging, and quite frankly, in the corporate world and in the business place, it's the piece that costs, is the equity piece. Are you doing the right work? So when we get up from the table, all these people who've joined us at this table, when they get up, what work are we doing? So how are we bringing the services to our community? Are we bringing the right services to our communities? When I first served as a diversity officer, I told them, listen, I'm not in HR. I don't do the people part. I don't do the hiring of people. I said, I will operationalize diversity. So before DEI was the thing, it was D&I.
Right.
And I said, I will only do this if I'm allowed to operationalize diversity. I wanted to make sure that when we had these talks, we were in our communities doing the work that those people needed. So it's great to have me because I reflect my community, but they need to know that I'm going to actually do the work. So when are you open? What hours of operation do you have? If you have an underserved community and everybody's working until 5 and 6 o'clock at night, but your office closes at 4:30, are you serving your community? So we do things to ensure that even our community clinics are open so that people can have access. It is ensuring not that we have the same care for everyone, but that we give people what they need so that they can have the same outcomes. Equity is making sure that people have the equal outcomes. So I'm going to make sure that everyone has access to a doctor. It might mean that in this community, I have to give you different hours of operation. It might mean that I have to pay for your trip to get to the doctor's office. What are those things that you need? And that's what equity leaders are tasked with identifying and providing.
So let me ask you this. I'm trying to kind of create this picture in my mind. So we have these 90,000 students that you serve in 200 clinics across the district. I mean, that's phenomenal. So a kid comes in or a child comes in and they seem depressed, or they're an elective mute. They choose not to talk to anyone. You know, they just there, they don't communicate. What is it that your service provides that drives this equity? Do you take them to get an assessment? Do you do that in the school? How does that work?
So the district has invested in bringing these clinics into the building. So there are in every DC public school, there's actually what's called a health suite and in 7 of our high schools, we actually have full-on primary care clinics, multi-room, multiple exam rooms, dental space, behavioral health space, labs. So it's a full-on, just like you would see if you went into a medical office building. So the district has done a great thing in saying we've got to bring these resources to the children at the school.
So these kids can get seen in the school?
Right in their school.
Amazing.
Right in their school. There's a little separate space. One of the challenges that many people in the district say, I do not share that space. So it's for this very reason. We are very protective. That space, while you can access it from the building, is reserved only for the medical care of the children. And so we are very clear that that space cannot be shared with any other individuals. They cannot have office staff. It is reserved. It is truly a health space so that the medical professionals who are there on the campus can serve the children.
Now, do parents of these children know that that service exists in their schools?
Absolutely. They actually, a part of the enrollment packet is that for the public schools and the public charter schools, as they say, yes, I need my child to have access to these providers. In the high schools, we offer vaccines, we offer reproductive health care. We have dentistry, we have behavioral health. It is a true clinic inside of the school. The district has done a great thing here.
I'm excited to hear about that. I've lived in the district for 30 years, and I didn't know that until I met you, that this service was provided to 90,000 plus students.
90,000 children.
That's phenomenal.
Yeah.
Well, we talked about, when you talked about disparities, you talked about, or equity, you talked about the importance of making sure that people are getting the kind of services they need, whether it's medical or behavioral. And we know that a lot of times the economic status of individuals affect the quality of care, of health care that they get. And in fact, in the District of DC, and these are some numbers you share with me, 19% of the African Americans in Ward 7 are unemployed versus 3.4% of majority white that are in Ward 3. That's a major disparity. And the median household income is $40,000 for Blacks versus 115,000 for whites. And then the educational attainment, which is also correlates with healthcare disparities, indicates that 25% of Blacks in the district or in this district area have bachelor's degrees versus 50% for all of the residents. So we can see those kind of differences. So tell me, how do those kind of stats affect the quality of healthcare that children receive, or for that matter, don't receive?
Well, I love what you just asked. How does it affect the quality of care that they receive? My job is to make sure that they don't. My job is to make sure that if you are in Ward 3 or Ward 7, you have access to quality care, that we are supporting and that we are identifying those things that you need to ensure that you have that quality and that life expectancy. But what I know you really want me to talk about is, what do those social determinants and how do they impact your care? And that's where equity comes in, is I have to get you over that hump. So education, your socioeconomic status, access to water. We have a number of housing projects across Ward 7 and 8 that really impact the asthma outcomes in the district. So there are children with HVAC and mold, HVAC problems, mold, unfortunately rodent infestation. Even in I live in Ward 2. In Ward 2, there are rodents that are all over Ward 2. And so in Foggy Bottom, if you are at George Washington Hospital and you're out at night, you will see little friends that join us here in Foggy Bottom. And so we are not immune to it, but our homes are protected because we have resources here in Ward 2 that may not be available to the communities in Ward 7 and 8. And so how do we then support? We work very closely with the Children's Law Center whenever there is, we have a recognized housing community where we're seeing increased numbers of students with asthma. We can have resources deployed to support the families and working with the landlords to get things in place to address mold, rodent infestation. There are rodents outside of my home. Children in Ward 7 have them inside their home. There are droppings in the home, and we've got to support that. And so we work with the landlords and the community and the housing authority to ensure that we have resources available because we see the medical impact of poverty in those communities.
So Dr. Boudreaux, excuse me, are you saying, when you say we,
Mhm.
When you're saying the programs, these 200 clinics that you supervise, these 90,000 students that you touch, are you saying you actively get involved in resolving those kind of issues or making sure?
Every day. Now,
Every
there are a few children that come to my desk. We have a couple kids that we call high risk that I actually get involved because the need is so great that it has been escalated to my desk. I don't touch every child personally.
of
But when
course.
the need is there, I do get involved. I have a phenomenal case management team or care coordination team that is comprised of case managers, community health workers, and they will say, all right, we need you to step in on this one because the need is so great. And so there have been a few students over the course of the year that I've been here that have required my intervention. But usually the things can be managed by the health suite staff.
Yeah.
Our nurses, our nurse practitioners, even some of my I have a medical director. Those individuals really reach into the community and support the children. The nurses who are on site every day make calls to the parents. They're working to get appointments with physicians. They can open a case with the law center if there's a need. So I have a team of people who really run into the community and say, we're going to bring healthcare to you to address the needs that you have.
Oh my goodness, this is so progressive and so needed. I'm just so full of excitement listening to the range
That's how they got me
of
back.
services and involvement that you're providing. So let me ask you this. How do you know that it's working? I mean, what are some of the results that you all are achieving in this?
Well, we're seeing a reduction in children sitting in the emergency room. So while we're not only, we don't only support Children's National and we don't only partner with Children's National, we do see Children's serves 85% of the children in the district. So when we see reduction in non-emergency ER utilization. So children are not having to go to the ER to get care because we're providing it in their schools. We have increased improved, I should say, health outcomes across the district. We're seeing a reduction in children in what's called the yellow zone. That's a child who needs emergency intervention in the emergency room. They're having an asthma exacerbation. We're seeing a reduction in those visits. We're seeing more children have a medical home, more children have access to a pediatrician. And we are one of the phenomenal, I keep saying phenomenal, but I'm so excited about it.
Because it is phenomenal.
I am so very excited about the work we're doing. I know that there's some other adjective out there, but I'm really excited. We have implemented telemedicine. So even while you're sitting in your school, we have devices in the school that the physicians at the hospital call into the device. Your parent can stay at work. They don't have to come and pick you up, and we can listen to your breath sounds. We can look into your ears, your throat, your nose, and understand your needs. Send a prescription to your community pharmacy so that any medication you need can be picked up on the way home. So mom, dad, grandma, aunt, uncle, neighbor, whoever, caregiver doesn't have to take off of work to come and pull you out of school to sit in the emergency room for a non-emergent need. We are able to assess. And so those children who do have emergent needs, we can then call ahead to the hospital to arrive them so that they're not sitting as long. And so we're seeing reduction in our ER wait times. And that is also a benefit to the community. We're allowing people to get care at the most appropriate place. So the ER is best for emergencies. I don't want anyone in my emergency room who does not need emergency medicine. And we're able to do that right there in your school.
Well, Dr. Boudreaux, let me ask you this question, because in this kind of work, you can get emotionally involved, right? Because you're dealing with these children who have medical issues who might not even get care if it wasn't for the services that you provide.
Yeah.
So my question is, why this particular role for you? I mean, what's your why?
When I left practice, I did so because it was so hard for my patients to get to see me.
I see.
There are too many barriers for children to get to the provider.
Mm-hmm.
Insurance, access, availability. If your parents' insurance changes every year and I'm not on that panel, then now your care has to stop. If I'm in private practice and I say I'm going to close at 5 o'clock so that I can have some sense of a life with my family, then what happens if you can't get to see me if your parent doesn't get off of work until 6:30? So it becomes a challenge. Insurance companies reimbursement rates are a problem in this industry. But it's not limited to mental health. That this is also an issue with primary care. It's pediatricians' reimbursement rates are not where they need to be. It's the conversations I have to have about reimbursement and the business model. We talk more about the finances than we do about the care delivery. I tell my staff all the time, I talk about the money because without a margin, I can't get to the mission.
Mm-hmm.
And so it became so difficult for patients to even get to me that I wanted to go into this public health space where I can truly impact outcomes. So every day I'm on calls. Literally before this time, I was with the Department of Health. And I sit with the Department of Health several hours a week. I'm on multiple calls with them, looking at how we're going to impact the lives of the children in the district. And so we are able to implement the policies that come from the department. And listen, everyone has a vision for how we solve these problems. And so it's always, this conversation, this back and forth with that team. But that's the work. I joined this organization because the focus, I'm not a nurse, and I was hesitant when I was initially recruited here because I said, I have no clue how to lead nurses. I'm not a nurse. My entire hospital career, we had a chief nurse that managed the nursing. And so here I am trying to drive a nursing program. We're expanding. We have expanded to have more primary care as well. But it was the fact that Children's National was committed to the public health, to driving and improving health outcomes. Children's invest a considerable amount. So I told you that we are the recipients of the School Health Services Program through the district, but Children's National funds a great deal of the work that we do that is not covered by the district. And so that partnership, to be able to have that connection, to really expand the continuum of care, to allow for us to serve more children has been just a joy. I get to see every day the benefits because every day, while again, I don't work with children every day, but I see them in our facility. I see them, I see their growth. I see the commitment in the community. I see how we're able to bring our care to the family as opposed to making them come to us.
Well, I hope you're not apologizing for not being able to see kids every day, because the leadership that you're providing allows for a broader system of care to 90,000 people, more than what you felt you could connect to when you were in private practice. So I am just really touched by by your vision, by the hospitals. And I mean, the whole Capital Children's Network. It's just phenomenal what you're doing. You made a point I wanted to follow up on a little bit. You talked about being able to provide care, connect the families, parents who are at work, so they don't have to leave their job to come and sit and wait in 15 hours in a ER room. So let me ask you, what can companies do to help and support the work that you're doing? Because you're helping them allowing their employees to be able to take care of their children yet still focus on the work. So are there ways that the private sector is participating or should be contributing to your work?
Oh, I love that. I don't see myself as the foundation. We have a great foundation team that supports us, but no, any dime that comes into our organization to Children's School Services is put directly into the community. So purchasing a device, those devices cost $6,500. So anyone who wants to give us resources, that means we can put those devices into more schools. There is a national shortage of healthcare providers, nurses, physicians, certainly pediatricians.
And psychologists.
Oh my goodness, psychologists, social workers, and psychiatrists. The entire gamut of mental health is just struggling today. So any resources that come in to help us with recruitment and retention of our very, very strained workforce is always helpful. I'm always looking for a way to recognize them and celebrate them. We are readying ourselves for Nurse Appreciation Week, which is the 6th through the 12th of May. And so we are planning now. I have a staff of 100, we have 198 schools right now. Now, I don't have a nurse in every school. We're working on that. We are affected by the shortage as well. So we have nurses moving all over the community to support children. And we have paraprofessionals that cover when the nurse is not available. But we are readying to support them. So donations to help us recognize them. Everyone loves swag. So anything that we can give to support. But certainly the telemedicine program is by far the most innovative and the one that will allow you to see the benefits of your contribution every day, because we are seeing, we had this week alone, we had our first waiting room on our telemedicine line.
Oh, I see.
Children were actually waiting in line for access to the doctor. And so we are talking now about growing the program and adding more providers because we're seeing so many children in need at school.
Well, you and your team and the Children's National
Hospital. Yeah.
Hospital. We just thank God for you. I just thank God for the visionary and the committed team and organization that you represent. And I just want to thank you, Dr. Boudreaux, for sharing the amazing work with us. I learned so much today, and I think I'm so informed. And I say to our audience, if you enjoyed this conversation, please like us and share our episode and subscribe to the Working It Out podcast. We also would love a review so that we can better serve you. I'm Dr. Vanessa Weaver, your host of Working It Out. And on behalf of our Working It Out podcast crew, who are phenomenal, like your nurses you talk about and your physicians, I have a phenomenal crew. And we just like to thank each of you for tuning in. And we wish you a safe, productive, and what we call Be Happy week. Goodbye.
Working It Out is brought to you by Alignment Strategies, a management consultancy with more than 3 decades of experience in diversity, equity and inclusion, and organizational development. To learn more, visit alignmentstrategies.com.
Got problems on the job, we're working it out. Workplace got you stressing, we're working it out. Yeah, we're working it out, working it out, working it out.